Hello, I'm Henry Fardell, dental surgeon, and I was very fortunate to be awarded the BSGDS scholarship in 2001. A lot of work has gone into this very simple idea that I've had of releasing dental impressions by either injecting air or water under the impression. Now, unless there's severe undercuts, it's amazing the results we can get, and we are about to show, we believe, that there will be a 95% likelihood of an accurate impression. Often when the impression pulls away from the dental tray, because of the high strength of the vacuum up against the tissues, we never see this pull away effect, but the impression will be then distorted, therefore the model is distorted. Usually we blame the technician for this, but actually an accurate impression is a work of art. And we're using the word ART, standing for Air Release Tip or Air Release Technique. And now, what I want to demonstrate is this new ART tip. Again, it's the Air Release Tip. And what happens is that it fits into the chuck of the 3-in-1 syringe, and it fits in very neatly. Screw the chuck very tight in place, and then you can bend this nozzle as you want if you'd like to bend it further. And what happens is that we can place this under the impression, and it basically pops air under the impression, so it releases it much better than normal, and you get rid of the vacuum. This is a technique that we use in industry when you have injection molding and air or water is blown underneath. Now we're going to demonstrate this. This is Kirsty, who's one of our nurses, and she's kindly volunteered to be the guinea pig for this impression. We hope you're impressed. Now remember, a good impression is a work of art. The impression tray, and basically take the impression for Kirsty, and I'm going to put a little in the palate. I always like to do this because it saves an eddy current of alginate. Breathing gently, let your lips go floppy. That's it, well done. And I'm just going to gently take that there. Let me just take your lips over there and basically wind the soft tissues or the skin of the cheeks and lips together there. Now, this is beginning to set. I don't use a handle on my impression tray. I tend to just be very, very gentle. I'm not forcing anything, not pressing anything heavily. The material has begun to set. In a moment, I will tell Kirsty that she'll feel a prod and hear a squelch as the air release technique works. It's begun to set. It hasn't quite set on the inside yet. There it goes. Give it a moment or two more. Almost there. So now I take the air release tip, which is in the 3-in-1 syringe, tell the patient a little prod and pull it back a fraction, and then just the impression, and there's the imprint coming through. What I'm going to do now is to just gently turn the impression back over, put the nozzle through the impression, and you'll see where it's coming there, just nozzle it, move it around. When you take it back out, it hardly leaves a blemish on the impression, and you get a very, very accurate impression with no pull-away effect. I'm now going to demonstrate the lower impression taking using the air release technique, or the ART tip. So we're basically loading the tray. I try to load it in one go so you avoid air bubbles, just in a smoothness across. I then put a little bit behind the lingual surfaces here. So just open now, that's it, just a little bit there. I tend to overload. Relax your lips. In a moment, Kirsty, I'm going to ask you gently, to, not yet, to put your tongue forward and waggle it round a little. That's it. And then I'm going to just turn the cheeks again. Put your tongue back. And when this is set, I'll use the air release technique again. And you'll feel a little prod and hear a squelch. The material has begun to set. Nearly there, not quite. Almost there. The ART tips are relatively inexpensive, and it is our duty to give the best impression possible for the technician and for the patient. So there's going to be a little prod here now. That goes up against her teeth. I pull back just a fraction, and then I just press the air on the air release, and you hear the impression coming up. Okay, good. So instead of tugging, you'll see there's a good impression there. and there's just the smallest of indentations where this went through. I'll once again demonstrate this. So we're going in here into the impression, and you'll find that it has just a tiny, I'm wiggling it around. I don't normally wiggle it around, but just for the sake of the video, in there. And so very little distortion of the impression at all. And a very nice impression. Well done, Kirsty. Thank you for being our subject. We'll just tidy you up now. Getting a good impression, I think, is more important than even having a tidy patient for that time. We hope that you've enjoyed seeing this video and that you'll invest in the best impressions for your patients. We at the moment have got this made for the Sanitip system, and we will be making these nozzles for the other systems that are available that you may have in your practice. But if you've got Sanitip, this is for you. Thanks. Another use for the ART tip is that it can be placed into a narrow bore suction tube and then act as an extension to it, so that it can go into small orifices in order to suck up liquids. So there you are. Now that could have been pus in a root canal or some spillage of blood around a tooth, but it's such an efficient, easy way and inexpensive way of coping with that situation. It could be used in endodontics for sucking up liquids out of the roots, perhaps using Milton's and so on. So there you go, another use for the ART tip. So it could be yours. Apply a very fine stream of air, say onto these upper premolars here. We could do that. So now I'm going to reach across and get the air water syringe and just gently blow right up against the tooth and specifically dry it. Now this could also be useful because if you're making a post hole in a tooth in order to have a cemented post in place, then you have a little drop of water in the root, there we go, and that can wash, and then we can then blow air on top, and so basically we can irrigate the root canal treated tooth where we're going to put a post hole, and we can blow air into the post hole, drying it, and then it's very thorough. What we do find is that when we use this, it's amazing, the water having been blown into the root where there's a post hole channel, I call it splat. I know it sounds terrible, but basically the debris that was left in the root comes out onto the mirror to demonstrate how much debris would have been in the root when we were putting the post in, and it shows that I'm sure that debris will hinder the cementation of a post in the best way. The ART technique using the air release tip is such a simple and inexpensive way to gain an accurate impression. We are claiming at the moment that our statistics indicate that we get a 95% plus more accurate likelihood of an impression accuracy. We've measured study models using the air release technique and the non-air release technique, comparing them using 3-dimension laser scanning systems. And what we want to do now is to say, please ask for free samples, or we can sell them to you for £1 per tip, which is comparatively inexpensive if you're going to get a good, accurate fit of your denture or whatever it is you're using the alginate impression for. Now, you may also find that you have other ideas to which we can use these tips. For instance, they can be bent. You might like to tell us maybe what we can do with that in the mouth. It's very exciting. We're going to produce more nozzles to fit other tips, and we will hopefully be able to share this idea with all the profession. We hope you enjoy it. Thank you for watching.